In the previous part, we have dealt with what is ARDS, what is the etiology of ARDS, what is the clinical features of ARDS, what is the pathophysiology of ARDS. Then there are three phases of ARDS, right? Exudative, proliferative and fibrotic phases of ARDS. Then the stages of ARDS, stage 1, stage 2, stage 3, stage 4. In this class, we can deal with what is the diagnostic measures of ARDS, what is the diagnostic criteria for ARDS, then the uh, management of ARDS, then complication. Okay. Diagnostic evaluation of ARDS, it includes history and physical examination. So in the history, the etiological factors we have to observe or we have to assess. Then physical examination, we have to check for the abnormal breath sounds like crackles. Then the physical examination, hypoxemia, the SpO2 levels that can be observed. Then other test what we have to do is arterial blood gas analysis. In that we can see the acidosis features. Then blood test also can be done. Then chest x-ray. Chest x-ray you can see the bilateral opacity. Then bronchoscopy. Sputum culture and analysis can be done in case of pneumonia related ARDS. Then other test we are doing is CT scan and the echocardiogram. And this is the exact picture of ARDS. So you can see bilateral opacity in the both lungs. Okay, we can see the differentiation between normal chest and the uh, ARDS chest. In normal chest, you can see the black color, right? So that indicates that the lung is functioning normal. But in case of ARDS, all whitish appearance in both lung. Okay, that is known as the bilateral opacity. So that is the typical feature of ARDS. According to new global definition 2023, ARDS definition criteria is there. So in that times to instillation, that is up to 7 days. Up to 7 days the patient have respiratory problems, and after that the respiratory problems will be severe. So that is the time to instillation, that is more than 7 days. Then pulmonary edema. Pulmonary edema, that is not explained by cardiogenic edema or intravascular volume overload. So pulmonary edema will be present for the patient, but it is not related to the cardiogenic or the intravascular fluid volume. Then radiographic features or radiological features, in that bilateral infiltration can be seen, especially in chest x-ray and CT, and it is not explained by nodules or pleural effusion. So these radiological features, there will be bilateral infiltration can be observed. And in case of mild ARDS, the partial pressure of oxygen level or FiO2 level will be 201 to 300 with NIV and or CPAP, a non-invasive ventilation or the continuous positive airway pressure, and PEEP will be greater than 5 centimeter of water. Then in case of moderate, here the PA2 or FiO2, that is 101 to 200, PEEP will be greater than 5 centimeter of water. The hypoxemia level, that is partial pressure of oxygen or FiO2 level, in severe cases it will be less than 100. So the PEEP will be more than 5 centimeter of water. The hypoxemia SpO2 or FiO2, that is less than 315 with SpO2 less than 97%. So this is the criteria, the new global definition criteria for ARDS, that is identified in 2023. Okay. The medical management of ARDS, usually the ARDS patient require intensive care unit care. So the person should be hospitalized and admitted in critical care area. And here there is no specific treatment. Actually, we have to treat the signs and symptoms first and underlying causes. The supportive measures include the supplementation of oxygen, then complete bed rest, monitoring of the person's the values, the oxygen level, then saturation levels, then pulse, then respiratory levels. All this vital signs monitoring is essential for this patient. Then we have to positioning the patient, the positioning from the supine to prone. So lower part will come to the top, so that's why the person will the person's perfusion status will be increased. Then um, in lateral rotation therapy, here lateral position to the patient by changing the bed, due to that here increased thoracic pressure. Okay, so lateral rotation therapy and positioning therapy that we are used in order to decrease the patient difficulty in breathing. Okay, so when we are changing the position, the pressure variation will be occurs and the person can smoothly breath. Okay, so that's regarding the positioning. So here usually we are giving two positions, turning the patient from supine to prone, and another position is lateral rotation therapy. Lateral rotation therapy in order to increase the thoracic pressure, and and the prone position that will helps to get maximum perfusion. So that's regarding the supportive measures of ARDS. And calorie should be increased 35 to 45 kilocalorie per kilogram. That should be recommended. The nutritional management is essential for the patient because it increase the metabolic increased metabolic rate because due to dyspnea. Okay, so that's why nutritional management also essential here. Next, regarding the pharmacological management, here we can give the antibiotics, that is penicillin we are usually giving in order to treat the pneumonia. Then anti-inflammatory drugs such as corticosteroids, dexamethasone, hydrocortisone can be given. Then diuretics we are giving Lasix. Then drugs to raise blood pressure, in that antioxidants or inotropic agents like dopamine, dobutamine to raise the BP. Then anti-anxiety medicines can be given. uh, we are using cautiously the anti-anxiety medicines and relaxants, muscle relaxants we are using cautiously. Then inhaled bronchodilators like the albuterol, then protropium bromide, all this can be given. Okay, then next management is the mechanical ventilation. So these all are the management we are used for the ARDS patient. In short, the treatment of ARDS include treatment of cause, treatment of underlying cause, in case of pneumonia, antibiotics. Then supportive therapy, that is 5 P's: perfusion, position, protective lung ventilation, protocol weaning, preventing complications. Then pharmacological treatment include steroids, vasodilators, surfactant, anti-inflammatory drugs, DVT prophylaxis, and reflux prophylaxis and sedation. The complications of ARDS include barotrauma, pneumomediastinum, pneumothorax, biotrauma, atlectotrauma, cardiac dysrhythmias, venous thromboembolism, ventilator-associated pneumonia, pressure ulcer, encephalopathy, oxygen toxicity. So, the complications of the ARDS, it affects the uh, all organs. So, multi-organ failure is the main complications. That's why here the cardiac complications and the encephalopathy, okay, neuro complications and renal problems, venous thromboembolism, all this can be observed. Then barotrauma, that is mainly due to the ventilator associated problems. Barotrauma, pneumomediastinum, and biotrauma, atlectotrauma, all are ventilator associated problems. So these all are the complications of ARDS. I hope you understood regarding the condition. Thank you.